ignorance, with disdain, and slavery.
In all 50 states, they have had school immunization requirements since the 80s. And this change would make Florida the first state to end the longstanding and constitutionally upheld practice of requiring certain vaccines for students. The Florida chapter of the American Academy of Pediatrics said today the move will put children in the state's public schools at higher risk for getting sick, which will have a ripple effect in the community. The CDC study also shows that routine childhood vaccines, like the ones included in school mandates, will have prevented millions of illnesses, hospitalizations, deaths, all while saving billions in direct access costs. Joining the conversation for this one is Dr. Chris Purnell. She's the director of the NAACP Center for Health Equity and Public Health and Preventative Medicine physician. And Dr. Purnell, you know this well. In 2020, we had 13 cases of measles. 2025, 1,400. A huge increase in whooping cough in this country. And at the same time, the rates of vaccine exemptions have gone up by about a point since 2019. None of this is by accident. None of this is by osmosis. And now this is
reckless. If I could sum it up in one word, let's just go to some facts, and I have them here to keep myself honest. Since the last 30 years, we've saved over 150 million lives because of vaccines globally. If we begin to think about in the United States, we've saved over 1.1 million children due to vaccinations since 1994. We've prevented 508 million illnesses and 32 million hospitalizations. That's not anything to wink at. That's hardcore data. But what's happening in the United States is as if we are a runaway train. In public health, we talk about the cliff of good health, and we have fallen completely off of the cliff.
That's kind of what it feels like that in a way, Ben, that everybody sitting at this table, all the folks in Florida, all of these people who are vaccine skeptics now have benefited from vaccines, allowing them to live their lives without polio, without measles. And now all of a sudden they want to pull the rug out from underneath children. I'm surprised by it. I mean, you have kids, a lot of us do at this table. If you lived in Florida, what would you be thinking?
Two things. One, they're not outlawed. That's good. The parents are going to decide. Two, there's a cause and effect, and the CDC lied to us about COVID, and they lied a lot. They lied about masks in school. They lied about distancing. They lied about the efficiency or the effectiveness of the COVID-19 vaccine.
Not true.
It is true. They said that distancing. Hold on, wait. Did they not lie about the effectiveness of a mask when internal
yes, if you
said
talk about
if the
certain
mask
types
did
of
not work in the
masks,
schools?
if we're looking at high quality masks, right? So
That's not what they said.
P95 masks,
I would love to
those
say that.
masks
They
actually
didn't say
prevent
that.
infections. Because
They
look,
didn't
this
say
is the way
that.
science works.
Hold on,
Science works that as you get data, the type of communication that you give will improve.
This is
But
what
you can't say the CDC
I actually think it's important.
It's very important.
If you're saying things that are not accurate, I do think it's fair for her to
The
counter that.
CDC said that masking was effective and worked when a new internal document said.
It
And
does
the emails
work.
came out that it didn't work.
Okay, well, what
True or
she
false?
does. Okay,
6
well,
foot distancing.
hold on a
True or
second.
false? The CDC said
Hold
that
on a
6
second.
foot
Misinformation,
worked,
folks.
and it
You're seeing it
didn't.
in action.
First of all,
They said it was going to stop the spread of
Misinformation.
are you gonna have a conversation, or are you just gonna keep talking? Look, hold on, okay? First of all, what she is disputing is your language around this, which is that they lied.
Yes, exactly.
Which she's saying, and I think she's right about this, is not true. There are certain types of masks that work better than others.
We've been using masks
and
for
B,
decades.
the whole point of science. I mean,
This is why Florida did this, and this is what you guys don't understand. There's a cause and effect. The American people don't trust the CDC for the reasons I said. You may not like that. You may not like the American people believe
Americans
that.
don't trust the CDC because people like RFK Jr. and others.
That's why RFK Jr. got the job he's got now, because so many people didn't trust the
Hold on a
CDC.
second. Okay, Ben, just give me 1 second, okay? This Florida Surgeon General has been railing against vaccines for a while, but he's also responsible for a lot of misinformation. He's altered key findings in a COVID-19 vaccine safety study.
Malpractice.
He pushed things like cures like ivermectin and others for
Wait, hold on.
COVID.
Did
Reckless.
ivermectin not work?
No,
We have data that shows that it did work.
no.
He is pushing
We
all
have
of those
proof
other
of data that it does not work
That's-
effectively.
Okay, Ben, are you really going to argue with the doctor?
Thank
at the
you.
time about this?
This is
With a doctor who is helping to save
when you all
lives,
listen
the
to doctors
safety net
during COVID,
institution,
you guys
when-
screwed us and we
when
failed miserably.
when
You
we
lied about a
Let me
vaccine.
move on
When we
because
listen to-
hold on 1 second. I just want to move on because I
Okay.
don't want other people join the conversation.
Okay.
Okay. The idea that all of this can be blamed on a virus that was novel in 2020, where we did not know a whole lot, and where I just want to play this because I think people forget sometimes, where the president at the time was Donald J. Trump, and this is what he said about vaccines at the time. His own vaccine, by the way, that he helped develop.
Self-nervous about getting a fifth vaccinated.
Oh,
They have to get the shots. The vaccinations are so important. This is really going around now. They have to get their shots.
so that, on measles, Trump in 2019 was get your measles vaccine. Operation Warp Speed, some people say he should be nominated for the Nobel Peace Prize. A fair argument to make. But now all of a sudden, this is about being lied to when people did not know a whole lot about COVID at the time.
Let's take a big picture. The COVID vaccine ended up being a miracle drug.
It did.
There is no doubt about that. You can say that certain people later on, in terms of booster shots, should or shouldn't have gotten this. Young men, you can make all those. The bottom line is, it was a miracle drug. Period. We have to start from that perspective. Then you talk about other vaccines, right? We're not just talking about COVID. And COVID's an excuse to basically say, well, we can't listen to anything. They're all lying to us. All these vaccines are bad. No, they're not. They've been proven year after year, decade after decade, putting aside COVID for a minute, that the rest of these vaccines work. So the fundamental question becomes, do you view this through the prism of I, or do you view this through the prism of we? If you
Exactly.
view it through the prism of I understand the point, which is, why should I be forced to get something that I may not want to get? I get it.
It had
I
side
hear it.
effects.
I hear
Like
it.
heart
No,
issues.
but see, but look, but there are medical exceptions. But there are medical exceptions in Florida where if you have a medical condition right now, you don't have to get those vaccines. If you have a medical exception,
Exactly.
the point is, if you view it as a we, as a community, we did that work.
Yes.
It was a failure.
Listen,
But
let's-
it's-
let's-
it's-
let's-
it's-
let's-
measles-
let's go to-
measles
let's
has been
go
a
to-
failure.
No,
let's go to the
I'm
week.
going
Herd
back to
immunity.
COVID-19
Herd
and why
immunity.
we're
I know
having
that it's
a conversation.
convenient to go back to COVID, but we're
But that's
talking.
where this started.
No, it
We were
didn't.
trusting them
No, it didn't.
before
Hold on, Ben.
COVID-19.
Right now, in this, hold on, Ben, right now in this country, Scott, the question is, should children going back to school, you also have kids, I don't know if they're vaccinated or not, I presume they probably are. If they are going back to school, should they have a vaccine for polio? Should they have a vaccine for measles, mumps, and rubella? Should they have a vaccine
For
for any
diphtheria.
number of things
Or chicken pox.
that we don't even talk about anymore because it's not really a part of American life because we've eradicated it because of vaccines? Should they?
Yeah, I think it's indisputable that vaccines have saved millions upon millions of lives, and that these vaccines for these diseases you're talking about work. I mean, they've been working for decades in many cases. I think that's fact number one. I think Dan raised an interesting point about you could hold two thoughts at the same time. You could believe that they work and believe that you don't have any questions about it, and you may also believe that the government shouldn't make you do anything that you don't want to do regarding health
Government
care,
makes you get a
whether
license.
whether you have concerns about the vaccines or not. There are people who do not believe that the government should be able to
Government
mandate
makes you wear a seatbelt.
anything like that. Well, there are people that don't think
They
that.
don't make you
Right?
drive.
And so,
Make you drive.
Yeah,
but
but
so
if
I
you're-
think it's
listen,
possible
if
for people to hold.
you
So anyway, I think that's kind of the debate that's going
The
on.
government regulates
Personal
how
liberty.
That is the debate, but I think Dan's point is, and I think this is super important when it comes to vaccines. Vaccines are not just an I decision; they are
Yes,
a
they are
we
we
decision
decision.
because they don't work as well unless and until we
Yes,
all
herd
participate in
immunity,
this.
herd
So that is
immunity.
part of what is the
But
discussion
it's not-
here when it comes to mandates because we are all